Hi, everyone. Thank you for joining the MQ Transdisciplinary Research Grants webinar. My name is Hala Rashidi. I am the Research Program Lead at MQ, and this webinar will provide you with information about this grant call from MQ, which is funded by Wellcome. So joining me also on this webinar is Manvi Tiwari. Manvi is a lived experience expert and activist, and she is a member of the Advisory Board for Global Mental Health Peer Network. Manvi will also be joining the funding committee for the Transdisciplinary Research Grants. Also with us today is Sophie Chung. Sophie is a Senior Research Manager for the Mental Health Field Building at Wellcome. And on the agenda today, we will start with the Wellcome and introduction. Then we will go through the rationale, aims, eligibility, remit, award package, the application process, evaluation process. And then I will hand over to Manvi, who will talk a little bit about patient and public involvement and provide some tips for the applicants. And then we will move on to the questions and answers. So before I hand over to Sophie, just a bit of introduction to MQ. MQ is a mental health research charity. We have two offices, one is in London and the second is in New York. And we have delivered £23 million of groundbreaking research through grants and collaborations in 37 countries around the world. And we've done so by designing and delivering grant rounds. So in addition to this call, we also have a mental health postdoctoral research scholarship that is now open for applications. And we also bring together experts in the field to drive policy and mobilize action and identify funding priorities. And we partner on research either as co-investigators or as advisors. Sophie, I'll hand over to you.
Thanks so much, Hala, and hi to everyone online. As Hala said, I'm Sophie. I'm a Senior Research Manager in the mental health team at Wellcome, and specifically I sit in our field building team, which I'll talk about in a few moments. We're really delighted to partner with MQ as the funder of this programme, and as such we just thought it would be helpful to outline kind of Wellcome's remit, our mental health strategy, and some of the orientation and rationale for this programme. So Wellcome is a biomedical research charity. We're based in London, but with a global focus, and we were founded in 1936. We exist to support science to solve the urgent health challenges facing humanity, and have committed to spending 16 billion between 2022 and 2032, so 9 years left, on 4 priority areas. The first and broadest of these is what's known as our Discovery Research Programme. So that's curiosity-driven research on any topic that advances our understanding of life, health, and well-being. And there are 3 funding schemes a year for this programme for research and tailored for researchers at different career stages. The remaining 3 are our challenge-led research programmes, which aim to really home in on and move the needle in mental health, infectious disease, and climate and health. And then beyond research funding, we also build global partnerships and conduct advocacy work in service of our strategic aims. So it's worth highlighting that mental health research at Wellcome can be funded through our Discovery Award schemes. However, our strategic programme in mental health has an additional focus around which we design further funding or commissioned work. And the vision of this team is a world in which no one is held back by mental health problems. And our mission is to drive a step change in early intervention for anxiety, depression, and psychosis. And early intervention there really has 2 levels. One, recognising that many mental health problems emerge early in life, before 30 years of age, as well as that mental health problems can have a significant implication on the trajectory of someone's life. So early intervention in the course of illness is also key. And our 2 primary goals to achieve this vision and mission is a better understanding of how mental health conditions develop and resolve, and then really hand in hand with that, developing better ways to intervene as early as possible. Recognising that research takes place in a wider ecosystem, our team also works on what we call enabling factors, namely how do we support better data, be that tools, resources, or processes, better measurement, and the ways and consistency in the ways in which we measure mental health in research, the policy and advocacy work that helps to create demand and ensure research is taken up and called for. And then finally, in supporting a field of mental health science that is a recognisable entity in and of itself, has a collective agenda, and is able to produce the kind of advances we're looking for. And the slides will be shared around, and there's a link if people want to read more about our mental health strategy in there. Next slide, please, Hannah. Wonderful. So I said I would come back to field building. And so this is a team at Wellcome that focuses on commissioning work or funding that helps to support a field of mental health science that is collaborative, coherent, and focused. And what we mean by that, or the challenges that we're perceiving, are one around collaboration. If you looked at the field of mental health science as it is now, using kind of co-citation analysis, for example, the field has lots of relatively disparate networks or subfields. Many people may not recognize themselves as mental health researchers as such, and there's often a lack of involvement of lived experience expertise, which means that researchers might not be focused on the kind of tangible and meaningful impacts or priorities of those most effective. So we're interested in supporting where we can and where's appropriate for Wellcome, an international collaborative field of mental health science that brings in diverse perspectives, spans disciplines and institutions, and embeds lived experience expertise at all stages of the research process. Then there's a challenge of coherence. So at present, there's a lack of agreed paradigms and concepts in what should be measured, how things are done, how things are defined, and a lack of shared understanding of where ideas have come from. And we'd really like to foster a field of shared understanding that enables the field to meaningfully move forward and produce more nuanced debates, recognizing the inherent complexity of mental health science and its histories. And then finally, we have focused. So at present, there are lots of disparate or dispersed research questions and fluctuating areas of hype or trend, which can lead to a distracted field, and that may only focus on a single level of explanation, be that biological, social, psychological, digital. So we aim to help develop the skills, tools, and demand for a collective agenda that is really evidence-led. And the best example of that at the moment is something also partnered with MQ, which is Galanos, a funded series of living systematic reviews in mental health research. So that kind of gives you the context of field building mental health at Wellcome, but really this program focuses on the collaborative element and the hypothesis that there's lots of brilliant people, brilliant ideas, and research that has wider applications going on elsewhere that either people in mental health science aren't aware of, or the people conducting that research aren't sensitized to the particular challenges or priorities of the mental health science field and just haven't considered those wider applications. And if we don't have a kind of shared collective agenda or space for conversations, how can we start having those, communicating this out more widely and having those conversations? And more importantly, how do we encourage people working in different areas to commit time and resource to working this through and starting that dialogue and doing that interdisciplinary or transdisciplinary work? So that's really the background to this program. And then I think the next 3 slides are just some high level logic of where we're starting from and what we want to achieve before I pass over to Hala. So the first is that we know that we need new ideas and avenues to pursue. Some treatments haven't changed in the order of decades rather than years. And part of that is premised on the fact that we have a limited understanding of these conditions and what works. That I'm treating as fairly unequivocal. So we are open to great research from anywhere. That's very much Wellcome's ethos, but we are aware that increasingly innovation comes from unexpected or surprising sources. And then thirdly, that lots of research at the moment is highly specialized and incremental, and that our traditional funding models do encourage that. So this program is about thinking about creating alternative spaces and opportunities for kind of creating connections across those specialized projections of research. And with that, I will hand over to Hala to take us through the program in more detail. Thank you.
Thanks, Sophie. So in terms of the aim for the transdisciplinary research grants, we have 2 main aims. The first is to fully support 5 to 10 researchers or research teams from backgrounds outside of mental health science to apply methods or concepts from their own disciplines to the progress of mental health science, accelerating early intervention for depression, anxiety, and psychosis. The second is we are going to trial and evaluate an exploratory funding program that enables researchers that time and space to develop innovative, ambitious, and speculative ideas. So in terms of eligibility, we expect the lead applicants to be researchers new to mental health science. And what that means is individuals who are currently working or have an educational background in disciplines that are traditionally recognized as roots to mental health research. So psychology, psychiatry, or neuroscience would not be eligible to apply for this funding. So we want researchers who are external, who are not from these 3 main disciplines, so not from psychology, psychiatry, and neuroscience backgrounds. We don't have a limit on research experience, so applicants can be early career, mid-career, or established researchers, but they do need to have a strong research track record in their base discipline and to demonstrate that track record in their application. These applicants should be employed at a host institution, and that institution can be anywhere in the world except for institutions that are based in countries which are under UK financial sanctions. And we actually, in the call outline, we share the link where you can find a list of these countries. So for team applicants, the team should be formed of one lead applicant and then co-applicants. And the co-applicants should have an added value to the project. So they should be able to provide a specific skill or experience or access to resources and infrastructure. And they should have distinct roles and responsibilities, which we expect to be clarified in the full application stage. But that being said, the co-applicants can be from any discipline, including mental health. So unlike the lead applicant criteria for eligibility, they can actually have a mental health background, particularly contributing and supporting the project by ensuring that that project is relevant and feasible and meaningful to the mental health science. And they can be based at institutions that are different than that hosting the lead applicant. So in terms of the remit or of the call, the project should have novel applications of methods, frameworks, and concepts from distinct disciplines to accelerate progress in mental health science, including anxiety, depression, and psychosis. And so what we're looking for are projects that are high risk and have a high potential and exploratory, because this is an exploratory program as well. So this is really sums it up in terms of the kinds of projects we're looking for. What is not suitable for the transdisciplinary research grants are projects that are focused on health service delivery, service quality improvement or redesign, and projects that are focused on mental health conditions other than depression, anxiety, and psychosis. Now, that being said, if the project actually progresses mental health science, including depression, anxiety, and psychosis, and that can transcend into those conditions, then it is eligible and it is suitable for the grants. But if it's focused on mental health conditions and cannot be expanded or transferred into depression, anxiety, and psychosis, then those projects would not be suitable for this grant. So in terms of the award package itself, the funding period is 6 months. So it's from January to June 2024. The funding amount is up to £50,000. We will fund the salary to cover the grant holder's time for the duration of the project. We will fund direct research expenses. So these can be consumables, data access and data charges. It can be open access charges and publication costs. Anything directly related to the research itself, travel and subsistence costs, and we will also cover patient and public involvement and dissemination costs. So it can be either infographics or videos as part of the dissemination. We also cover the payments for lived experience experts and people with lived experience to cover the time and skill and experience that they've really inputted into your project. So that all can be included in the funding. In terms of the grant activities itself, so the grant holders will be expected to review relevant literature and produce a viewpoint paper of publishable standards. So it can be a personal view, it can be a review, a position paper, and then we also expect the applicants to produce a single-page summary of their work. In addition to these deliverables, we expect the grant holders to attend 3 convening meetings at the start, mid, and end point of the award. And these meetings will also be attended by the funding committee and by Wellcome, and they will be an opportunity for the grant holders to share and present and develop their work with guidance from the funding committee and Wellcome. And so what we want to highlight really is that We're not going to provide the funding and then set you off on your own to do all the work. We will provide support throughout the project, and we will also provide networking and training opportunities tailored to the needs of the grant holders throughout the project. So in terms of the application process, we have 2 stages. The first is the expression of interest, and then we have the full application stage. So the timeline is the expression of interests are already open. They will remain open until the 8th of September. Then shortlisted applicants will be invited to submit a full application that will be open on the 22nd of September and will remain open until the 23rd of October. Then between October and November, the funding committee and external experts will review the applications, and we should have a decision by December 2023. And then the award start date is January 2024. So in terms of the application itself, you will need to submit your application online using the grants management system, FlexiGrant. So you would need to go to mq.flexigrant.com. You need to register for an account and then go to your account and then applications. And you will find all of the MQ open funding schemes. And as I mentioned, because we have more than one funding round currently open, make sure that you select the right scheme. So that is MQ, a Transdisciplinary Research Grants, Expression of Interest. And please make sure that you read the guidance before you start your application. In terms of the application itself, it has 5 sections. The first is the applicant details. You will be asked to provide contact information for the lead applicant, as well as information about the employment, education, and training, and to list the awards that you've received for any achievement and work or training, to list any grants that you currently hold, and up to 5 publications that are most significant or relevant. You will also be asked to provide a personal statement, really summarizing your research experience, what transdisciplinary is important to you, and what skills will you bring to mental health science, and why are these important? And then we have another section in that application form for team applicants. So we will only at the expression of interest stage ask you to provide very brief information and contact details for the co-applicants, but then you can elaborate, you will be asked to further elaborate on that in the full application stage. The third section is the project overview. This is very brief, so you will be asked to provide the title of the project, the total funding that you're requesting, and just to tell us what area or discipline the project is in or covers. Then we have the project summary, and here you will be asked to summarize the proposal under the headings of aims and objectives, background and rationale, and then a work plan, and finally, the potential impact and outcomes of the projects. You can provide references, and though this section does have a word limit of 800 words, the references are not included in the word limit. And finally, we have a patient and public involvement section. So this, in this section, you will be asked to provide a clear summary using non-technical language. This should actually summarize what your project is, what you intend to do, why it's important, and most importantly, how do you plan to involve patients and public in your work and in dissemination. And we also, we do provide resources that can help you write this section. So please make sure that you go and you make use of these resources and not just copy paste sections from the project summary to this, to the patient involvement section. Just to note that we will provide support to grant holders throughout the grant to develop their patient and public involvement skills. And we don't expect everyone to be experts in doing so, but we do want you to reflect on how patients and public can be involved in your work from this stage as early as possible. So in terms of the assessment, we have a funding committee, and that funding committee includes international experts, including academic experts from diverse disciplinary backgrounds, primarily mental health science. We also have lived experience experts on the funding committee. And the applications will be assessed based on the experience and qualifications of the applicant or applicants, the potential of the proposed project to accelerate advances in mental health science. So what we're looking for, again, is high-risk projects, but projects that have high potential, and you need to be able to demonstrate that potential in your application. Novelty and boldness of the proposed ideas. So to what extent do the proposed projects support new applications of methods and concepts into mental health research and beyond really state of the art? And potential for further development of the proposed project in terms of scale and applicability and ambition. So how can this project actually be taken further and developed later on? Feasibility, and that's the ability of the applicant to successfully complete this project with the time and resources available to them. And finally, the proposed use of funds, and this is in relation to how aligned are the funds and the breakdown of the funds with the work plan. So, and just to comment that last point will be mainly the focus on in the full application stage, but because at this stage, we're only asking for a total. So what's the total funding that you're requesting? It will not be accounted for and will not be considered in the review of the expression of interest stage. So that's it for me. I will stop sharing now. Okay. So I'll hand over to Manvi. And Manvi, my question for you. Hi, Manvi. So first of all, what would you be looking for in the application in terms of patient and public involvement? And what tips do you have for the applicants?
Thank you, Hala and Sophie, first of all, for the amazing presentation. So yeah, I'll dive straight into it. And I think one of the things that I will be looking for in all the applications is intent, because I'm totally mindful of the fact that public and patient involvement and engagement, PPIE, is a relatively new field. It might even be alien to a lot of researchers, especially early career researchers. So we're totally going to be mindful of that while going through the applications. But yeah, we will be considering the intent, the efforts, and the willingness to learn, and the willingness to go on with that kind of trial and error method. The willingness to actually involve lived experience experts and public and patient meaningfully and not just tokenistically. So yeah, and like to everybody that's here, everybody that's listening and intends to apply, just make sure that intent and those efforts are clearly, very clearly stated in your application. I do not personally expect you to have it all laid out, have it all figured out, because public and patient involvement and engagement is not easy. It's relatively new, like I said, but we're also going to be mindful of that. And MQ will provide you support in accessing, that lived experience experts, in having public and patient involvement and engagement strategies in place and all of that. So that's one. And there's obviously different levels of public and patient involvement and engagement, from basic to advanced. So I think some of the tips that I have, for starters, one of the tips that I always say is that when you're talking to somebody from, the public and patient groups, make sure that you're not using, like Hala, you also said that you're not using a lot of jargon. You're not using very technical terms, because these are people that are not trained in research. Okay, so a lot of times when researchers are speaking, we tend to forget that the other person is not a trained researcher. They do not know all that scientific jargon and all the technical terms and abbreviations. So be mindful of the fact that they're not trained, and use as simple language as possible. ensure that it's a safe space for them to share. That is, again, one of my most important tips, because the inputs that you'll get won't be authentic as long as it's not a safe space. So, how do you plan to make it a safe space for public and patients that you'll be involving? And how do you plan to give them credit, for the research, for everything that you'll be carrying out? That is another point. So a lot of times researchers, while involving public and patients, you involve them, and then after that, there's no credit given to them. They're not really kept in the loop about what's happening in the project. So how do you plan to, carry out that kind of effective public and patient involvement and engagement in the long run? How do you plan to, not just tokenistically, like I said, not just tokenistically involve public and patients, but actually design with them, create with them, whatever you're innovating, innovate with them. So that kind of efforts and intentions is what I hope to see in the applications, what I will be considering in the applications. And yeah, I think that is all of my advice really for public and patient involvement and engagement. Yeah.
Thank you, Mavi. Thanks so much for these tips. So now I will try to go through the questions. So bear with me. Okay. So the first we had was about how we would define the field, and if there's because there's overlap between social science and psychology, and if the main applicant must be from a different field. So our answer to that is yes. So that, as I mentioned, what we expect is for the lead applicant to be new to mental health science and to be from a discipline that is different than psychology, psychiatry, and neuroscience. But that being said, social sciences is like people who have a background in social science would be eligible to apply. And to make it a bit clearer, so what we are looking for with this program is to support the development of new ideas and new thinking and new connections. So we don't want the lead applicant to have an extensive, long-standing history of publication in the field relevant to mental health. So if they work at something that's in the intersection, like social science, like in social science, for example, but they don't have that, they haven't published, they haven't worked in mental health, they're providing something new and a new idea, something that's interesting, then that, yes, they would be eligible to apply. Sophie, do you want to add to that, or?
No, I think that clarifies it very well. I think it's about people's core discipline and research history being new to mental health science, and that's really what we're looking for in these applications.
So the other question is if it's okay for the main applicant from other disciplines, but in the teams having collaborators from psychology. Yes, so the collaborators can actually have an educational background in mental health. But again, you still need to make the case. You still need to just highlight what is new, what are you proposing, what's the new development, what's the new thinking that you're bringing about in the application. So because that will be part of the assessment. What should be the involvement in mental health research of PIs and co-Is? I think that's something that we've covered in this answer. And then, just to clarify, the distinction in the role itself is the lead applicant would be responsible for creating and submitting the application and will be accountable for the completion of the grant activities and financial management of the grant. The co-Is, as I mentioned, would have an added value to the proposed work and a distinct role to that. So they will be able to support their project, the proposed project based on their expertise. I would like to know if this current call is limited to systematic literature review alone. Can we do a trial-based study in our local community setting, or collaborating partners like from the UK would be necessary? So I don't think we have a restriction, but I think the core requirements and deliverables would be to have a review and to conduct that review and to produce that publishable piece of work in addition to the summary. But if you want to, as an add-on and to contribute and to have this full project, then that is more than welcome. Sophie, I see your hands up, please.
Thank you. Yeah, I guess I'm conscious of a couple of things. One is that the budget is quite low. And I guess the other is that we recognize and actually encouraging that this is a slightly risky and exploratory program for us. And I think the biggest challenge is ensuring ideas that are coming from outside the field are relevant to the challenges inside the field and relevant to people with lived experience of mental health problems, which is why in the first instance, even if the intention is to support later interventional research, the limitations of the summary and the review that will be conducted is kind of secondary research only at the moment.
Okay. What type of institution, university or private startup?
I think Manvi had her hand up as well.
Oh, Manvi, do you want to comment on that? Sorry.
Actually, I just saw another question. Which was about PPI. So the question says, do you have a guide of recommendations for PPI? And I wanted to answer that. There's two really excellent guides, for recommendations for how you can effectively involve public and patients. And that is one is, which will kind of give you an idea of it, is the WHO guide for involving people with lived experience of non-communicable diseases and mental health conditions. That one, and there's another one which has there's a report which has been taken out by the Global Mental Health Peer Network. So feel free to go on their websites or Google it up, and those are some guides which have really amazing tips. So yeah, I just wanted to add that. So it was a short, easy question. It can do wonders with the application. So
thanks, Manvi. What type of institution, university, or private startup is eligible? So eligible health institutions include higher education institutions, third sector organizations, research organization. So it's really what we're interested in is for it to have the resources to be able to support the applicant and the grant holder throughout that grant. And you need to have that contract, that employment with the organization, because they will be part of the the application, and they will be part of the contractual agreement that we make later on as part of the award. We have, in terms of what it can be, as long as it is a research organization, and it has, and you can actually make the case for the support that you're going to receive for that duration, and that you will receive the time, the space, and the resources to conduct that review, then we're happy with that host institution. So we have a question from someone who has an interdisciplinary background. My PhD also started out in a sociology department, but was moved into psychology upon departure of my supervisor. I, however, have no formal training in psychology and have specifically done a thesis. I'm unsure of my eligibility. So I don't see why not. If you don't have a background in psychology, there is really, again, if you're new to mental health science, then you're welcome to apply and you're eligible to apply, because we are interested in your ideas and what you bring to this field. So yes, you are eligible. Can the person be trained outside the mental health science but have an established history of publications on mental health? I would say, because we just talked about the established history, so that person can be a co-applicant but cannot lead on the application itself. Is public health, I'm not sure what that physician eligible as a lead applicant. So it's again the same answer, to be honest. So I can't really comment because I don't have enough information about your educational background and your experience and your work. But again, if it's if you're coming up with new ideas, if it's something that if you don't have that strong publication history in this field, you don't have a mental health science background, and you're able to bring new concepts from other disciplines to mental health research. That's what we're really looking for. So are you able to touch upon those disciplines and bring new concepts and new methods to mental health research? That's the question. Are PhD students eligible? Yes, because we say all career levels, that does include PhD students. I do have to say that you do have to have a research track record, as I mentioned, and so you need to be able to show that you've already published, or that you have enough of that research experience to carry out that project. If you can demonstrate that, I don't see any reason why PhD students cannot apply. Can projects use psychology, for example, psychometric tests? Sophie, do you want to comment on this? Because I feel like a lot are just we're also around, like, how close can they be to mental health science? That's really the question.
Yeah, I'm not entirely sure what use psychology means, but I think if you are bringing something from a core discipline outside of psychology but applying it to a psychological construct or something used within the field of psychology, then that is absolutely in scope. And if I've misunderstood the direction of that question, then I'm really sorry, but as that stands, I think that is our stance on that.
But also feel free to clarify if we did miss out on that question. Does the money go to the institution or to the main applicant? So the money does go to the institution, and because also we have and that's the reason why we've asked that the applicant should be hosted in an institution. We recognize that they will need the support and the resources to carry this out, but also because when there's co-applicants involved, and they might be from different institutions, then we need for that to be managed and to be done correctly. And so the answer is yes, the money will go to the institution, then the institution will issue the payment to the applicant, and then we'll also expect it to have any other contractual agreements done with third parties. So our agreement would be with the institution and the lead applicant. Are multi-sited pilot studies of interest? Sophie.
Sorry, I was just coming back to Natalia in relation to the question before around use of psychology. And I think, to me, that applying linguistic theory to cross-cultural validity of psychometric tests is the kind of transdisciplinary application we're looking for, and not everything has to be an interventional study. So hopefully that clarifies. And in fact, we're not looking at direct interventional research, only feasibility, and from secondary research at the moment.
And do you want to comment on the multi-sited pilot studies? This is
that one is, I guess, slightly hard to answer. I guess if the application is able to fit within the bounds of eligibility, are you bringing in a concept from your core discipline? Are you applying that to multi-site pilot intervention studies? And are you able to do a narrative review of the feasibility of that? Then yes, but that's slightly hard to answer.
So the next one is the grant looking for interventional research or exploratory research? So, and correct me if I'm wrong, Sophie, but I think we are looking for both, but it can be, I'm not sure, because intervention, it can be at the intervention level, but if you're bringing out new ideas to that. Sophie, do you want to comment on this? I'm not sure, to be honest, but I don't see what the limitation would be. Exploratory intervention research?
Yeah, I think we're interested in both kinds of research. Just to highlight that the actual nature of this grant is just a secondary review, a review of secondary literature, looking at any ideas within mental health research. So interventional research could be in scope, but only from that perspective.
Okay. Can multiple expression of interest be submitted? Would an application be disadvantaged if a lead applicant on one application is involved as co-applicant in another application? Our answer is applicants should only act as lead applicants or co-applicants on one application. So I would say if it can be, so that's the restriction, to be honest. So we would stick to one application for the applicants. What things can be budgeted? I think we went through this, but I can just give another overview. So the salary to cover the time for the grant holders will be budgeted, direct research expenses, and travel and subsistence costs, as well as patient and public involvement and dissemination costs can be included. So what's not included is any indirect costs. So if it's something related to HR or finance or heating bills, within the institutions, that would not be covered, but anything that is directly related to the research being conducted or the review being conducted itself, then that is fundable. Should both the lead applicant and co-applicant be outside traditional mental health science? Only the lead applicant is expected to be from a discipline outside the traditional mental health science. Co-applicants can actually have a mental health science background or experience. Okay. About the final deadline for the full application, it is the 23rd of October, 2023. Oh. So the budget of, there's another question from Sarah about the budget of £50,000, if it's limited for running human studies. With that in mind, is the scope focused on acceleration of knowledge, like reviews, data access, co-involvement of lived experience in shaping this knowledge? I'm not really sure what running the humans, so that budget is, as Sophie mentioned, it's what we're looking for is for you to have that time and space to conduct your review and to involve lived experience experts and to consider what concepts and methods that you can bring from your core discipline to mental health research. So that should be the where the funding is focused. And involving lived experience in generating this new knowledge is an integral part of the project as well. So I would say yes, that can be in the budget. If the PI is from computer science background, but has publications on mental health, are they still eligible? I think we've covered that in what we said about having a long-standing history of publications. So I don't know enough to say no, but I would say if you were to submit an application, you would need to say, because you need to make that distinction of what is new and what angle specifically for this project. So how are you applying it? How is it different than all of the other work that was conducted? Or so Sophie, do you want to comment more on that? Because specifically for computer science background, again, like social science, there's a lot of intersection. There's a lot of work that's already being done. So what we're looking is beyond state of the art, beyond what's been done already.
I don't have much to add to beyond yourself, Hala. I think if you've got a long-standing publication history specifically on this idea and this is merely extending that, then that's not the ethos of the programme. And it's hard to comment without looking at the individual applications.
Thanks, Sophie. I think Madhvi covered the next one about recommendations for PPI, but also to mention that we will try to share the links with you when we're sharing the FAQ document as well. So we will include those in the links. We have a question about 3-year PhD student eligibility to apply, which we've already answered. And I think, yes, the answer is yes, you are eligible to apply as long as you demonstrate your research track record. and experience. There's another question about the restriction to depression, anxiety, and psychosis. I work on chronic pain. Clinical studies show that chronic pain often induces depression, but would this connection be sufficient to make an application looking at chronic pain eligible for this scheme? Sophie, I'll hand over to you. I always say yes, to be honest. So I'll hand over to you anytime I'm inclined to say yes, this is applicable. I'll just hand over to Sophie.
Yeah, I think the remit of this call is early intervention for anxiety, depression, and psychosis. If you can make a connection to how it progresses that agenda, then it's eligible. So yes. Is it also worth, sorry, I feel like there's a few questions coming in about the interventional research component. So I wonder if I can just clarify, A, it sounds like we need to just put together clearer guidance. So we absolutely take that as an action from this. And B, yes, this is not a call for primary interventional research. It's only a 6-month program. It's £50,000, and it can look at the feasibility of an interventional idea, but it won't be able feasibly to be able to conduct that work in this period. And as I said before, one of the risks that we're conscious of with funding kind of novel ideas is that they need the groundwork to make sure they're relevant to mental health science, have worked with people with lived experience in their setup. And I think that 6-month period could look at that, but it won't be able to do it all in that time. So I hope that clarifies for people, and we will look out to put more detailed guidance out on that as well.
Okay. We have a lot of questions about the social science background. And again, so if you have, because if they're still eligible to apply, even if their field of research is mental health, then no, you would not be eligible to apply as a lead applicant, but you can apply as a co-applicant to this, because that does mean that you have that research experience and that you've already published in this space of mental health. So you're not exactly new to mental health science, which means that you wouldn't be eligible to apply. Will you be eligible to apply if you're from an unrelated field, but you've already published in mental health? Again, it depends, because we did say, so the cutoff, if you have a publication history relevant to mental health science, then you would not be eligible to apply as a lead applicant. And then there's a question about conducting if the funding and the duration is for conducting actual studies or for carrying out the review and generating a viewpoint paper. As Sophie just mentioned, that it would be for conducting the review and generating the viewpoint paper. And it can be, and it's about exploring those ideas and building them and seeing how relevant they are to mental health science, but not actually conducting a full. It's too short a time and too limited fund to do that. Comparing a single PI and a team of PI, what is preferable? I'm thinking about applying and conducting the study by myself. Will that be a disadvantage? No, that will not be a disadvantage. And we did open it for individual and team applicants, and we will be very fair when we are doing the assessment to that. And even for the co-applicants, there should be justification on why the co-applicants were selected and what additional values or skills they bring. But it doesn't put you at all at a disadvantage. What we will judge is you as an applicant, your experience, the proposed idea and the novelty of that idea and how strong it is and how further it can be developed. So being not part of a team will not put you at any disadvantage. The budget of £50,000 is limited for conducting human studies. With that in mind, through our scope for this funding scheme is about dissemination of knowledge. I'm not sure I understand this question. So if it's you, can you rephrase, because I'm not sure what the question, if it's about because dissemination can be budgeted for and costed as part of the project, but it has to be around the review that's being conducted. Paper tangential to mental health. Again, with respect to the publication, if you've published, if you've published in the field extensively and you have that publication history, then you can't be a lead applicant. You're not eligible to be a lead applicant on this. But if you can please clarify this question for me, that would be great. Thank you. Anxiety, depression, and psychosis are in many cases a result of trauma. Does the grant funding include trauma research? I will just reiterate what Sophie said, and not as good, but the gist of it is if you can make that connection to anxiety, depression, and psychosis, then yes, it is suitable for this research, but the onus is on the applicant to actually make that link and make the case of why it is important and how it relates to anxiety, depression, and or psychosis. Okay. A few questions about PhD. So if you weren't there, yes, if you are, is a PhD essential for a lead applicant? The thing is, we did say that it's open to all career stages, but you do need to have sufficient research experience. And so it really depends on the research experience that you have. And if you're able to, stand out and really demonstrate that you have a strong research track record, you're able to do this, and you have that potential and capacity and background and experience to achieve this project, there is no limitation. So when we say all career levels, we did mean it. You just need to show us your research skills and demonstrate that you are capable of doing this project and to compete with other applicants who might be applying for the school. If I'm supporting someone applying for the postdoc application recently published, is it possible for me to then lead on this application? Yes. So the two are not related. They just happen to come from MQ. But if you are supporting someone on the postdoc application, you can definitely apply as a lead applicant. You just need to make sure that you manage your time and that you're able to do this project and the site. And I don't see why that should be an issue at all. So they're just from MQ, but you can definitely lead or be part of both applications, the postdoc application and this transdisciplinary call. So assume by publications that you mean peer-reviewed paper. If so, does that mean that early career researchers and current PhD students would have little chance of success? We do include actually conference papers. Preprints can be included in there. But if you do have a peer-reviewed publication, then include it. So again, when we say it's open, that's why we ask about the grant funding, the awards, and we do ask a personal statement about your achievements. So we are trying to cover it. It's not just about the publication. We will take all of these factors into account when we are assessing the applications. So it will not be to your disadvantage, which just needs a very holistic picture so that the funding panel can actually make that assessment. So it doesn't mean that you have little chance of success. You just need to make sure that whatever research experience you have is reflected in that application. Would the grant only pay the lead applicant salary? Would there be a possibility that it would fund a salary of the co-applicant if the lead applicant is near academic? What we say is that it should cover the time. So it's not the full salary, just to make that clear, because it's not going to be enough to cover the full salary. It should be able to cover the time dedicated by the grant holder or grant holders. So that does extend to co-applicants as well, but within reason. So that's why there's that final assessment where it should be justified. So is this how much time will be dedicated by this co-applicant to the project, and does it align with the work plan? That's what you have to demonstrate in the full application. There is a question from an anthropologist who intends to apply for this funding to conduct. Can it solely be used for fieldwork expenses? So what I would say to that is it's completely up to the applicant to decide on how the funding will go. It will be part of the assessment, but what I would advise is, because there are multiple criteria and because we are very keen on patient and public involvement, we do expect that the applicants will actually direct that budget and will actually budget for patient and public involvement as well, because that, if all of that is directed toward the funding is directed towards field work, it doesn't really leave much for patient and public involvement. So you need to budget in a way that ensures that take into consideration all of the assessment criteria, what we're requesting, patient and public involvement and dissemination included, and then plan for your funding as well. So I can't say there's a restriction or it's a complete no, but our advice is you need to consider the best allocation of funds to this project, and that wouldn't be by directing all of that funding towards fieldwork. I'm very conscious of the time. We still have 2 minutes. So what I want to say is just a very brief overview. I'll try to recap. This application will be open for all career levels, and as long as you can demonstrate that the lead applicant is new to mental health science, they're bringing new ideas, new concepts, and new methods to the field of mental health science from their core discipline, and they can show the novelty in this, then they are eligible to apply. And if you do have long-standing history or publications relevant to mental health, then you are not eligible, because that goes against that first eligibility criteria I just mentioned. You can be a PhD student, you can come from different career levels, but the onus is on you to demonstrate that you do have sufficient research experience to carry out that project. So make sure you are very clear and you can demonstrate that in the application. And what I just want to remind you of the deadlines. So the expression of interest will be open from now until the 8th of September. We will then let you know, inform you of the decision, and for those who are shortlisted will be invited to submit a full application on the 22nd of September. That full application will remain open until the 23rd of October. October and November will be the month where the funding panel will conduct the review to the full applications, and then we will have a funding decision by December 2023. And the awards are expected to start in January 2024. We will get to all of your questions. We will address them and answer them and share the FAQ document, as well as the recording of this webinar and the guidance document with you and with everyone who has registered for this webinar. So thank you for joining us today. We appreciate the time, and we hope that this provided some more information and answered most of your questions. So thank you all.